And the other cervical that we're doing is that this one, the second one that we'll do is for the upper trapezius, and the one we're doing here is more for the paraspinals. Now, you need to be a lot more gentle with these tissues in the neck than the thoracic and lumbar spine. Okay? So start out probably about half as strong or less than what you think you need to be, and let them give you feedback as far as, is it too much, is it too little pressure? Okay? So what I'm going to do here is, first, one way to do it is I can just stabilize with my cranial hand, and then I'm going to bring her up slightly. I'll stabilize with my cranial hand, and then I'm looking for paraspinal. So right here's her spinous process. I come off, and these are her paraspinals. So I'm going to start here, and I can do it with the tips of my finger, but I really don't want to dig in and really flex those fingers. I want to keep those pretty much extended. How is that? And see, even though it's fine and I've started out with just a little bit of pressure, if it's somebody that has neck pain, I really want to be very, very gentle to begin with. We talk about what our goal with this is to get those muscles to relax, okay? And if they're tensing up, there's no way that's going to happen. So it's always, always, always better to be more gentle with it to start so that they trust you, and when you get them in these positions, they'll just relax, rather than just trying to dig in there and say, I've got 5 minutes and I'm going to loosen up as many restrictions as I can in those 5 minutes. Okay, I can do it that way, or I can get in here and I can use both hands to come up. Is that okay? And so what I'm looking for is right here's her transverse process, which we know that is really tender. I'm going to be a little bit more dorsal to that, and trying to go from there and dig into all of those paraspinal tissues.
Your pressure is always medial, sorry. Go ahead. Are you always pulling pressure
up towards me?
You?
Towards me, yeah. So it's really coming lateral to medial, or even a little bit posterior, just because of the orientation here. A little bit three-dimensional in this area. Okay?
If they're having a lot of neck pain, what's the most comfortable way to get them into this position?
You may have to do it supine, so it really depends on what position they can tolerate. It could be that her neck would tolerate it here, but she's had back pain for 10 years, and she doesn't tolerate extension. So it may be you have to use some of the other techniques that we've used. The supine, doing oscillations. The technique you choose could be based upon what position she could get in. That may be how you have to choose it. Okay? So it depends on a lot.